About the REN 15. REN 15, the point is located 7 chun proximal to the center of the navel and 1 chun distal to the xiphoid process, right? So this point in fact is good point to treat for the cardiac system as well as is the digestive system. Of course, at the same time there is anything related to the conceptional vessel and then Dhumai meridian. So you know that there is only one luvo connecting point is located on the REN meridian. That point to be called as Jiuwei. So Jiuwei. So this point is located 1 chun below this. Certainly you can use this point. In fact, this point is very crucial to treat for the called as a Dhumai meridian. That means is the governing vessel meridian, and then is the REN meridian communicating point. Here I wanted to tell you there are the one point here is communicating midway between the Dhumai, that means is the spinal cord, and then the front midline of the body. Communicating point is REN 15. At the same time, when you wanted to use another point to treat for the REN meridian, which we call as a confluential point to treat for the whole front line of the body, that point known as a Li Chu, that is called as a REN 17. Sorry, Li Chu is that is LU7, right? So this point is always is good to communicate that. At the same time, Dhumai meridian communicating point known as a Huxi, that is SI3. So when we add up this both the points, Huxi and then Li Chu, then there are the communicating point. There are the supportive points which are called as a Li Chu and Shaohai, Huxi and then Shenmai. That is SI3, UB62, LU7 and then K6. You just activate 4 points. You can treat for the numerous diseases related to the conceptional vessel, related to the Dhumai vessel meridian. You are integratedly adding. The whole body can be governing by 4 points. That point is called as a, these are the 4 points, right? Apart from that, you wanted to add up the another point. That point is called as a Jiuwei. That point also REN 15 you can activate, right? So when we wanted to see the another most coming points are important points, this point is REN 16 point is called as a Chung Ting. So this point is located on the ephisternum, where the 8 chun above from the navel. So on the midline, where we call as the end of the xiphoid process, right? Exactly on the we call as a 5th intercostal space. So 5th intercostal artery also supplies to this particular region, and also these points where we call as a REN 15, REN 16, these points are the superior epigastric artery supplies to this particular region, right? So when we look at about the REN 17 is the most crucial point to treat for the many diseases. When you look at the image, the point is located midway between the 2 nipple on the center line, where the 4th intercostal space or at the level of the 4th intercostal space is located this point. At the same time, 4th intercostal artery and the nerve supplies to this particular region, right? When look at about the artery, the nerve is the 4th intercostal nerve. The artery which supplies to this particular region, that means is the Chung Ting, that is the REN 16, REN 17 and REN 18 and REN 19. These are the regions where the mammary artery, there is the lateral and then medial and then superior mammary artery supplies to this particular region. So therefore, once you activate this point, and certainly this is in fact is treatable for the various conditions related to the pulmonary system and also the central nervous system and then cardiovascular system. There are the 3 systems are incorporated by using this point. That means is the junctional point of the 3 systems. So that means you are activating to the, because of this point is move front alarm point for the pericardium. Pericardium is the outer covering layer of the heart, no doubt, but at the same time this having the functional unit to treat for the related to the neuron related conditions or the psychological related conditions or the mind related conditions can be treatable by activating this point. Of course, at the same time is the majorly this point function to the specific tissue which we call as the lungs tissues. This point is treatable for the bronchioles or the bronchi. So therefore, whenever you feel there is a problem, asthmatic conditions are there, the long-term asthmatic issues where the chronic asthma conditions, certainly you can use this point. When you insert the needle, you should not insert the needle directly. Make sure, this is the very caution. Once you insert perpendicularly in the deeper level like this, that having the chances, sometimes is the foramina is there on that particular region hollow, that will damages to the sternum, that will damages to the internally, that leads to the complication. So therefore, wherever you wanted to apply, you just apply in the downwards direction, or you wanted to apply in the upward direction, you can use it in the upward direction or the downwards direction. Both are recommended here. When you wanted to treat on the lateral side of the body, especially when we wanted to treat this point for the cosmetic purpose, then you remember there is the underdeveloped breast or the overdeveloped breast, or we call as a very atrophy of the lactiferous duct or atrophy of the pectoralis major muscles. Even the hanging of the breast is there. Even that condition you wanted to use, you just use this point as the towards the nipple. For example, you just apply towards, this is the midline, you just apply in this direction, you just apply in the other nipple direction, that you are activating and regulating to the muscles. When you wanted to treat for the sagging of the muscles of the breast, then make sure that there are all the organs, all the muscles to be controlled and regulated in the proper position. That point to be called as that meridian to be known as a spleen. Of course, there are the points is in pai, thatu, thigh pai, kungsun. These points is always good. Spleen 1, 2, 3, 4. This always is good if the patient gets some kind of the misalignment of the muscles, or the misplacement of the muscles, or misplacement of the organs, or the dislocations, etc. Anything related to the muscles get deviated from the one place to other place. You remember that means you need to activate along with the local points. You just add up the another point called as a spleen points. However, you wanted to use the another point which we call as a Tian Chuan. So that point is the pericardium one point, one chun lateral to the nipple. At the same time, one chun proximal to the nipple and distal to the nipple. So those points also which we call as a Burang, Rujan. So these points we called as a stomach 17 and then stomach 18. So these points also good to treat for all the breast related conditions. Even the patient is complaining that the lactiferous ducts are not functioning, where the milk secretion is not happening to the woman. Even that condition also you just apply towards this and then apply the local point in order to improve the overall the lactation is more, because of says that. So in generally how many years are required to nourish the child? But generally there are the 2 years is recommended to nourish, but sometimes ये बिलाले करते हैं तमाशे के मुझे दूध नहीं आता. So all these things are related to because of they don't want to nourish to the child. It's not all the women, some of the women. So that time is not good. At least the 2 years minimum you need to nourish to the child as a milk secretion taken place. But when it is due to some malfunction, due to some low energy, the patient is not able to get it. Even that condition, certainly you can use these local points. At the same time, I wanted to add up, there are the 2 points for the breast related diseases or the breast milk secretion. The point is called as Shauza and then foot lynchy. The point is small intestine 1 and then gallbladder 41. Anything related to, remember this, anything related to the breast related issues, then you wanted to treat for the anything, the lump is there, cyst is there, inside there is a benign tumor is there. Even the Birad'S condition 1, 2, 3, 4, 5 is there. 4, 5 is not treatable. If the Birad'S are 1, 2, 3 is there, certainly you can treat activating these local points. At the same time, you wanted to add up the another point called as a Feng Long. That point is the stomach 40 to dissolve all the known and unknown causes of the lumps which is existing on the breast. Certainly you can use the points along with this REN 17. Right, REN 17 is the meeting point of the spleen and kidney, triple warmer and small intestine. Therefore, it is all are connected to the the digestive system, at the same time is the bone system, at the same time is the pulmonary system, right? So therefore on the cardiac system as well, this is also, it is the point which we call as the influential point for the pericardium as well, influential point for the cardiac tissue also, cardiac tissue, and then the lung tissue as well. The respiratory system influential point is REN 17. So therefore this is functioning directly to the bronchioles in our lungs. So therefore this point is good to treat for the numerous diseases related to the respiratory system. When you wanted to treat by activating this point, only the needle or pressure, or you just take one kind of the magnet or one kind of the seed, or you just place it over that region and then put the plaster, and certainly that point keep on to getting the activation. So when the medical doctors are there, even they do the procedure which we call as a catgut therapy of that particular region. They take the small thread which we call as especially the sheep intestine they take, and they do the sutures. The sutures purpose they do the thread. That thread to be made by the sheep of the sheep of the intestine. So through that, or the horse intestine they take and they do the one kind of the thread, sutures thread. So that thread they take in the needle, and then that through that putting the needle, and they insert the needle downwards direction from here, and then they insert till here. How the sutures we do the procedure, in that way the thread is there in that suture, so they will cut up and downwards direction. Whatever inserted inside that, the thread should be remain the same, and that point to be activated continuously to the patient in order to treat for the respiratory asthma conditions. Certainly in that way also this point to be activated. That the thread dissolve on their own for the span of 15 days. Later on further you wanted to treat again after a fortnight, you just apply the same procedure to activate this REN 17 point as well. But initially the non-medical doctors is not recommended to do